And joining us now is our Africa Health Network correspondent, Linord Moudou. What do you have for us today, Lino?
Hello, Dimiake. Well, studies by the United Nations Environment Programme, UNEP, says communities in developing countries are facing increasing health and environmental risks linked to exposure to mercury. The 2013 Global Mercury Assessment says emissions of the toxic metal from artisanal gold mining are significantly greater than were reported in 2008. Rising gold prices are driving greater small mining activity, but new and improved reporting has also provided more accurate estimates of emission from the sector. The UNEP study assesses for the first time at a global level releases of mercury into rivers and lakes. The report says an estimated 260 tons of mercury previously held in soils are being released into rivers and lakes. Negotiators from the 120 nations are meeting presently in Geneva for a final round of talks meant to agree a treaty to reduce the use of mercury. Joining us by phone from the negotiations is Nick Nuttall, Acting Director for Communication and Public Information at UNEP. Mr. Nuttall, welcome to the show.
Yeah, thanks very much.
Thank you for joining us. First of all, can you give us a sense of how humans are exposed to mercury and also some of the health consequences?
Well, you know, mercury is an element. It's a naturally occurring substance. But so when people burn coal in power stations or when certain mining operations happen, you get releases of mercury from the coal or from the metal ores. But also mercury is actually used as a catalyst to get gold out of the ground. And it's also found in many, many products, from thermometers and other medical equipment, right through to things like modern energy-efficient light bulbs. So there are huge numbers of sources of where mercury is coming from, and the health risks have been known for well over a century. Health risks in terms of particularly babies getting brain damage from being exposed to mercury, but many, many, many other health risks that people are running as a result of increasing amounts of mercury in our environment. One of the principal sources of getting mercury is through eating fish, but also if you look at small-scale gold miners, when they're actually heating up the gold ore to try and get the gold out, they are using this mercury as a catalyst and they breathe it in. So everybody around the world has some levels of mercury in them, and some communities are even more vulnerable because of the kinds of processes and activities that they're conducting.
And very briefly, you are participating in the negotiations on the new Mercury Treaty. What are some of the recommendations?
Well, basically what we want to see is certain products phased out. Certain products are phased out on certain clear timetables. We need to see more controls on the emissions of mercury from burning coal in power stations. There's some very simple technologies that you can add. And then things like mining mercury. Some countries are still mining new mercury, bringing it out into the environment, and in a sense using it in their countries, and at least one country is exporting it around the world. We need to bring that to an end. There's enough mercury in the world already for all sorts of processes.
Okay.
We don't need any more. And we also have to help developing countries store waste mercury right now. That's an urgent requirement.
Mr. Nuttall, thank you so much. That's all the time we have for today. Thank you for joining us. And that was Nick Nuttall, Acting Director for Communication and Public Information at UNEP. Back to you, Vincent Dimiake.
Well, thank you so much, Linord, for joining us. And please be sure to join Linord on In Focus every Tuesday and Thursdays. Always has the latest news